Okay, now in this video we will discuss physical carcinogenesis. In the previous video we have discussed chemical carcinogenesis. Now we will discuss physical carcinogenesis. Physical carcinogenesis includes physical agents which are categorized into two groups. Two groups are radiation and non-radiation. Radiation and non-radiation. Radiation includes ultraviolet light. Ionization radiations are the most important physical agent. Radiation. Non-radiation includes physical injury, any mechanical injury, and prolonged contact with the certain physical agents that are included in the non-radiation physical carcinogenesis. Now in the radiation, now we will discuss about the UV ultraviolet light. Ultraviolet light, source of ultraviolet light is sunlight from the sun, then UV lamp, welding arch. Then efficiency of the UV light depends upon the melanin pigmentation of the skin. So the higher incidence of the skin's cancer are seen in albinos, farmers and outdoor workers, and white race. Okay, white race. Why? Because the melanin pigmentation is less, so the protective mechanism of UV light is impaired. So there is higher incidence in the albinos, white race, and also the farmers and outdoor workers due to the effect of actinic light radiation. Now what is the mechanism of the UV light? UV light physical carcinogenesis. Mechanism is induction of the mutation, inhibition of the cell division, and inactivation of the enzymes, and finally the cell death. Now we will discuss the main mechanism of the UV light physical carcinogenesis. UV light triggers the formation of pyrimidine dimer. That is formation of dimer. Dimer formation takes place in the DNA. So the proof of the pyrimidine dimer is xeroderma pigmentosum, Fanconi's anemia, and Bloom's syndrome. In this all, there is a proof of the UV light exposure. Xeroderma pigmentosum, Fanconi's anemia, and Bloom's syndrome. So this is all about the radiation carcinogenesis that we have discussed. UV light. Now we will discuss ionizing radiation. Ionizing radiation includes X-rays, which we all know about that. X-rays, alpha rays, beta rays, gamma rays, radioactive isotopes, protons, neutrons, which can cause cancer in animals and men. Now मोस्ट फ्रीक्वेंटली रेडिएशन इंड्यूस कैंसर, जो रेडिएशन की वजह से जो कैंसर होता है वो ऑल फॉर्म्स ऑफ ल्यूकेमियाज, कैंसर ऑफ थायराइड, स्किन, ब्रेस्ट, ओवरी, यूट्रस, salivary glands. It can induce all cancers, all form of leukemias. Okay, then cancer of thyroid, breast, ovary, uterus, myeloma, salivary glands. The evidence in support of the ionizing radiation physical carcinogenesis is there is increased incidence of radiation dermatitis. Radiation dermatitis. Radiation dermatitis is noted in X-ray workers and radiotherapists. X-ray workers and radiotherapists. There is increased incidence of osteosarcoma, which are engaged in the luminous radium workers. Luminous radium workers, osteosarcoma. There is increased incidence of cancer in minors, which are radioactive elements minors. Then Japanese atom bomb survivor. There is notably acute and chronic myeloid leukemias and various solid tumors of breast, colon and thyroid are seen. Then therapeutic irradiation is seen in patient with ankylosing spondylitis, in children with enlarged thymus. Then CT scan can induce leukemia and brain tumors. Now let us see the mechanism of the ionizing radiation. Mechanism: it alters the DNA, it dislodges the ions from the water and other molecules. जो ions dislodge from the water and other molecules. So there is the formation of oxygen reactive species which damage the DNA. ऑक्सीजन रिएक्टिव स्पीसीज का फॉर्मेशन होता है, जिसकी वजह से जो ऑक्सीजन रिएक्टिव स्पीसीज होती है वो डीएनए को डैमेज कर देती है. So this is the mechanism of the ionizing radiation. In the UV light, formation of the pyrimidine dimer, and in ionizing radiation, main mechanism dislodge of the ion and formation of oxygen reactive species. Now let's discuss non-radiation physical carcinogenesis. Less important, but we have to take into that in our point. Non-radiation physical carcinogenesis include mechanical injury and prolonged contact with a certain physical object like implants, surgical implants, okay, foreign bodies, occupational exposure of the asbestos, hardwood cutting workers. The stones in the gallbladder can cause cancer of the bladder. So this is all about the physical carcinogenesis. Thank you.